You ever see one of those IV bags in a hospital and wonder, what is actually in there? I'll tell you one thing, it's not just water. And getting it wrong can be incredibly dangerous. Today, we're going to break down the 3 simple solutions that can literally mean the difference between life and death. So let's get right to it. What is in that bag? You see them all the time in medical dramas. Maybe you've even had one yourself. Is it just some kind of fancy, expensive water or something more? Well, the answer is actually way more precise and, frankly, pretty fascinating. It really all boils down to one simple, absolutely critical goal: balance. We're talking about maintaining the perfect fluid balance for our trillions upon trillions of cells. You get that balance right, you can save a life. You get it wrong, well, things can go south, and fast. And it all comes down to 3 basic types of solutions. So let's start with the first one. This is the baseline, the happy place for our cells, the body's natural state of perfect equilibrium. We're talking about isotonic solutions.
And I've got a great little memory trick for you on this one. When you see isotonic, I want you to think isoperfect. Simple, right? It's called perfect for a reason, because its makeup is almost identical to the fluid that's already inside our bodies.
So what does that really mean? Well, an isotonic solution has the same concentration of solutes, things like salt and sugar, as our own blood. And because everything's already in balance, water doesn't need to rush into the cell or flee out of it. The cell just chills. It stays stable, happy, and exactly the same size. Okay, so when would you actually use this perfect stuff? Well, it's the absolute go-to for any situation where you need to pump up the body's fluid volume without making the cells freak out. Think low blood pressure, severe blood loss, or even certain serious diabetic emergencies. The 2 big names you'll always hear are 0.9% normal saline and lactated ringers. But even with something that's perfect, there's always a catch. You can definitely have too much of a good thing. The biggest danger with isotonic solutions is giving way too much, way too fast. And that can cause something called fluid volume overload. And let me be clear, this is no joke. It's really serious. That's why a patient's blood pressure has to be monitored like a hawk. A sudden spike is a massive red flag because it puts them at a much, much higher risk for a stroke. Okay, so we've seen perfect balance. But what if you need to, intentionally throw things off balance to fix a problem? That brings us to our next solution, hypotonic. And for this one, I want you to get a picture in your head. Think big, think round, think full of water. This is honestly my absolute favorite mnemonic. For hypotonic, I want you to think hippotonic. Yeah, like a big ol' hippo. It sounds silly, but I promise this one little trick will tell you exactly what's about to happen to the cell. So why a hippo? Well, a hypotonic solution is basically more watery. It has a lower concentration of stuff dissolved in it than the inside of a cell. And nature hates an imbalance, right? So water sees all those extra solutes packed inside the cell, and it rushes in to try and even things out. The result? The cell swells up, just like a hippo. You'd use this when the cells themselves are all shriveled up and dehydrated, like in a patient with really high sodium levels in their blood. The whole goal is to get water back into the cells. Now check out the names of these fluids: 0.45%, 0.225%. Notice a pattern? Here's another little trick for you. A lot of numbers and decimals in the name usually means a lot of fluid is going into the cell. But as you can probably imagine, making cells swell up on purpose is, well, it's risky business. The biggest, scariest danger here is cellular edema, which is just a fancy term for swelling. And when that swelling happens in the brain, it's called cerebral edema, and that is a top-tier, life-threatening emergency. This is why monitoring is absolutely critical. You have to watch for any change in mental status, new confusion, restlessness, a sudden headache. Those could be the very first signs of brain swelling, which can quickly spiral into seizures or a coma. And here's the non-negotiable rule. You never, ever give hypotonic solutions to someone who already has increased pressure inside their skull. Period. All right, so we've met the perfect cell and the hippo cell. It's time to meet our final character in this little drama, the skinny cell, brought to you by Hypertonic Solutions. And yep, you guessed it, we have a mnemonic for this one too. For hypertonic, I want you to picture a really skinny, energetic, hyper person, someone who just can't sit still. That image tells you exactly what this solution does to the body's cells. Hypertonic solutions are the complete opposite of what we just saw. They have a much higher concentration of solutes. They're really thick and salty. So this time, osmosis works in reverse. Water gets pulled out of the cell to try and dilute the super concentrated fluid outside of it, causing the cell to shrink up.
So why on earth would you want to do that? Well, in some very specific situations like severe low blood volume or heat exhaustion, you need to pull fluid into the bloodstream very, very quickly. And notice the fluid names: 3% saline, 5% saline. The memory trick here is just the inverse of the last one. Very few, simple numbers in the name means very little fluid is going to stay in the cell. Now, the danger here is a real double-edged sword. As you're pulling all that fluid out of the cells and into the blood vessels, you risk causing fluid volume overload, just like with our first solution. But at the exact same time, you're causing cellular dehydration. You're basically fixing one problem by potentially creating two brand new ones.
Okay, whew, that was a lot, I know. So let's do a super quick review and put all three of them side by side to really lock these concepts in. All right, here's your cheat sheet. Isotonic, think isoperfect. The cell stays the same. Hypotonic, think hippotonic. The cell swells up like a hippo. And hypertonic, think of a skinny hyper person. The cell shrinks. Seriously, if you can just remember those three images, you've totally got this.
So what's the big takeaway here? Why does any of this matter? Well, this isn't just some abstract concept for a biology test. Understanding this delicate dance of fluids is absolutely fundamental to taking care of patients in the real world. I mean, think about it. The ability to manipulate osmosis, to precisely move water into or out of our cells, is an incredibly powerful tool. It's how healthcare professionals can rehydrate a patient who's on the brink of collapse, or how they can carefully reduce life-threatening swelling in the brain. It's really just simple physics, but it's applied to save lives every single day. When you really step back, life itself is just one constant, delicate balancing act. From our body temperature to our blood sugar, it all comes down to keeping trillions of tiny cells in perfect harmony. It really makes you wonder, if something as simple as the amount of salt in water can hold the power of life and death, what other